Welcome to everyone. Today we're going to talk about metabolic syndrome and how employers can stop this health crisis in its tracks. So as hopefully everyone has known, at least by joining this webinar, it's metabolic syndrome is a leading cause of sickness absence, rising healthcare costs, and decreased employee well-being, as well as loss of productivity in the workforce. Simply defined, metabolic syndrome is a cluster of risk factors that increase a person's risk for major chronic diseases, such as diabetes, heart disease, hypertension, high cholesterol, and more. But it is reversible. We have the power to make a difference both as individuals and employers. So that's what we're going to talk about today. Um, so welcome. Thank you everyone for being here. Please pop any questions you have into the chat as we go. We'll try to take them as they come in. And if not, then if we sort of don't get things, then we'll have plenty of time at the end as well to take questions. So please do pop them in and we'll go through them as we can. I am Liz Swanton. I am oops, let me see if I can get my screen working. There we go. I'm the co-founder and COO here at Qured. Have a public health background as well as a business background, but certainly I'm not the medical expert here today. So I'm joined with our medical director, Dr. Kishan Vithlani. He's also an NHS GP as well as a private GP and has decades of experience. Has worked with us at Qured from the very beginning and is an expert in preventative healthcare as well as diagnostics and wellness. Also Natalie, she's a registered nutritional therapist and functional medicine health coach, and has also joined us here at Qured over the last, I guess, year or two with webinars and providing expert advice. So thank you both very much for being here today. Why are we as Qured hosting this? So Qured is a data-led whole workforce health screening platform. So we provide the most frictionless solution in the market. We very much believe in accessibility and the fact that everyone should be health screened. And metabolic syndrome is one of our big focuses. It's really because it is, as we'll talk about today, something that affects a lot more people than we think it does, and is something that really everyone should be aware of and be tested for. So that's really, really important to us. That's really what we believe in, and is about making sort of testing available and accessible to everyone by employers. So we also believe that employers have both a duty of care and a great opportunity to help reduce sickness in their workforce. That's why it's interesting to us and why we're hosting this conversation today. So before we go too much into detail on what the metabolic syndrome is, let me first see if I can get up. Sorry, I'm trying to get up my controls for a poll. There we go. I would like to ask everyone a quick question. So, can people see this? Question is, had you heard of metabolic syndrome before this webinar? All right, I think we're just about there. Here we go. All right, can everyone see that? So we're about half and half. So it looks like about half of you had heard of metabolic syndrome before and about half hadn't. I think that's fairly common. That's probably what we see as well. If anything, that's probably a little more informed than the average. But that's really helpful for us to know sort of where we're starting, and hopefully we'll be able to give everyone a really good overview of what metabolic syndrome is. So with that in mind, I'm going to hand over to Kish to tell us a little bit about metabolic syndrome.
Thank you, Liz. So what is metabolic syndrome? Well, it's a cluster of different conditions that really increases your risk of chronic diseases. So you've got the statistics there in terms of how much it increases the risk of heart disease, stroke, diabetes, but also so many other conditions, because the underlying processes which causes metabolic syndrome affects nearly every single body system. So we've got a figure there that you're going to have a 1.5-fold increase in premature death, and that's because metabolic syndrome is also linked with things like cancer, dementia, but also mental health as well. So it's a really, really important thing to sort of get a head around and understand. and figure out how we can address this and how we can prevent this. So, what are the key indicators of metabolic syndrome? So we've got lipid imbalance. So that is an imbalance of your good and bad cholesterol. So specifically looking at HDL, which is a marker of good cholesterol. And, we often underestimate the importance of the HDL, and we always focus on the bad cholesterol and LDL if you've ever had a blood test before. But actually, the HDL is really important because it has a real preventative aspect to it in stopping that inflammatory process in your blood vessels and preventing that narrowing of the blood vessel that causes heart attacks and strokes and things like that. So having low HDL, but also having high triglycerides. And triglycerides are a marker of the saturated fats in your diet. And when they go up, they cause an inflammatory process that causes further damage to the blood vessels and leads to these chronic conditions. And then high blood sugar. Now, high blood sugar we often associate with diabetes, but it's not just diabetes. There's a much, much longer process that can happen before you develop diabetes. So you might have heard of pre-diabetes, but also impaired fasting glucose, which means that when you're fasting, your baseline blood glucose levels are a little bit elevated, and impaired glucose tolerance. So if you have something to eat, how your body reacts to get rid of that glucose from floating around in your blood vessels and getting to the right places. So, for example, your muscles and your liver and things like that. So, uh, lipids, high blood glucose, but a spectrum of that, and abnormal liver enzymes. And this is a really important one because abnormal liver enzymes very commonly suggest fat being deposited on the liver, and that suggests that you've not only got fat on your on the superficial surface of your skin, but also on the internal organs as well. And that as a process in itself can cause so much damage further down the line. So this is what is identified on a blood test, but also it's obesity, so a high BMI, so if you're overweight or obese, or a large waist circumference, and high blood pressure as well. And when all of these key indicators come together, you only need 3 out of these, the ones that are listed here. That increases your risk of the chronic conditions. So, what are the underlying processes that are shared by all these key indicators? And it's important to understand this because this sort of relates to the symptoms that you get from metabolic syndrome, which we'll come on to a little bit later. But insulin resistance, that's one of the most important ones. And what that means is how your body responds to insulin, which is a hormone that helps store the glucose, the main fuel source in our body, in the right places. And if your body's not responding to that hormone in the right way, then that's classed as insulin resistance. Also, visceral fat, which means fat being stored on the organs, because when you get to that stage, that means there is damage happening, and that causes all the other effects in terms of narrowing blood vessels and inflammation and things like that. And that goes on to abnormal inflammation. So if you think about it, that you don't have any inflammatory process, or you don't have an illness or infection, but your body is reacting in the way that it does think that there is inflammation going on, and that causes underlying damage. And a process called sympathetic overdrive. And what that really means is your body's in that fight and flight response. So, say, for example, you were scared or you're in a dangerous situation, your body would increase a hormone called cortisol, which raises your blood sugar, mobilizes more energy. And that in itself can cause damage further down the line. So, it's a bit like, if you think about an analogy of sitting in your car, standstill, and revving your engine is a bit like the sympathetic overdrive, where you're going to be doing damage to your engine or the internal organs because your body thinks that it needs to respond very quickly. So, why are we talking about metabolic syndrome now? Well, there's various reasons. If I look at it from my work at Qured, we've done a lot of these blood tests looking at liver enzymes, cholesterol, diabetes. And we started to notice a pattern that actually we're seeing a lot of abnormalities across a whole range of the population. So, typically we think about heart disease, stroke, diabetes as something that affects if you're of an older age, or if you've got a significant family history, for example. But actually, what we saw, that the number of people that were affected by the changes that would associate with metabolic syndrome was the same across the younger people in an organization, and also at a much older at the older level of the population as well. So everyone is almost equally affected, and that's why it's so important to get on top of this and understand why this is happening and how we can prevent that from getting worse. When I put on my NHS hat, when I'm in my GP surgery, what I notice is that nobody's actually ever heard of metabolic syndrome. I see patients all the time that say, okay, my blood pressure is okay, but my cholesterol's a bit borderline. I've not got diabetes, but I'm pre-diabetic. and my liver enzymes are a little bit abnormal, but I drink a little bit, and I think actually that the patient thinks that that's fine. There's nothing wrong. And when I tell them actually all this together means that you've got metabolic syndrome and you've got a significantly raised risk of having chronic illnesses, it's a big shock. So, we definitely need more awareness of metabolic syndrome, and we need to talk about it a lot more as well. Also, it's not something that you often see. You get a diagnosis from your GP to say, hey, you've got metabolic syndrome. Often they'll say individually, oh, you've got high cholesterol and you're pre-diabetic and you've got high blood pressure and you're a little bit overweight. But when we look at it individually, we really underestimate that risk that you get from metabolic syndrome. We need to think about this together as one underlying process, which is significantly increasing your risk of having serious chronic illnesses. Natalie, did you want to tell me from your perspective what you thought about metabolic syndrome and why we don't really talk about it that much?
Yeah, of course. And thank you for highlighting it, because it is so important that we don't keep segmenting these issues and talking about them in silo, because when they do come together, we do get a very different scenario. So thank you for highlighting that so well. But I guess from my perspective, from a nutritionist perspective, when people are coming to see me in clinic, the conversations we're having don't start with, I think I've got an issue with my metabolic health. It starts with things like, I'm exhausted when I wake up in the morning, even though I've technically had a good night's sleep. I always need to have something on hand because I crash and need to eat something every few hours. And conversations around just this sheer inability to not be able to manage their energy, and the fact that the food that they're eating doesn't seem to be actually enabling them to create energy. And that's metabolic health, really. When we think about it from my nutritionist hat, I'm thinking about, can you eat food and effectively produce energy from that food? And if you can, we've got a good metabolic health. If we can't, we've got a problem. We also want to think about, can you tap into your reserves, so your fat storage, where you've got reserves of energy, and utilize that in times when you don't have access to food. And I see a lot of people really struggling with that. So the ability to be metabolically flexible, to use easy access glucose, sugar versus stored fat for fuel, is also really challenged more now than ever. Yet we still have this challenge where we aren't across the health spectrum talking about insulin resistance very well, and we're not talking about metabolic health very well. So I'm really pleased we get the opportunity to highlight that today. And I think what people are also seeing, potentially, you and I, Kish, have had a chat about this, when you are turning up at the GP office and saying, right, okay, we've got these blood markers, they're out of range, I've got this set of medication that I can give you. The conversation that you and I have had, and I've had with other GPs that I collaborate with, is that actually a lot of people are turning around and saying, I don't want medication. Have you got something else? What do I do to help to change the trajectory of my health? What can I do for my food? What can I do for my lifestyle? And I will let Kish speak to the challenges within the NHS, which I think he'll touch on later. But there is that real shift that we're seeing. We've definitely picked up a pace since the pandemic, of the fact that people are much more aware of their health. They're much more fed up of feeling not on top form, not being able to perform at their best, taking longer to recover from illness. And they want to start making a change. We're seeing great people highlight the issue we've got with our food system, with ultra processed foods, with portion sizes. We've seen plates grow from a 22-inch plate to a 28-inch plate, and yet we're not understanding why our waistlines are growing with it. We've got real light being shed on this aspect, which is leading to people feeling less than their best self. And it's really nice that we can start being part of this conversation to help people understand how they can navigate this change, one, in the workplace, and then two, when they get home and in their own time as well.
Yeah, absolutely. I think that that's wonderfully put, both of you. And I think it's interesting from, talking what the point that you raised about it just means that people can't recover as well. And, we see at the overall macro level, numbers coming out about the number of people off sick from work and the number of days lost. And we see that increasing. And it's not just about being super, super sick all the time. It's also about every day just not being able to recover as well, for sure. So, what are some of the sort of signs and symptoms? Do you want to talk through sort of what you might see that would indicate that you might have metabolic syndrome?
Yeah, and I think yourself and Natalie touched on some of the symptoms that we actually see very often. And we can break this down into what the sort of underlying process is that's leading to this, because sometimes it's difficult to sort of relate, a syndrome to symptoms and why you're feeling in a certain way. But some of the common things we look at is fatigue, for example. People are always saying how tired they are, how much burnt out they feel. And that's due to sort of the underlying insulin resistance that you get as part of metabolic syndrome. And that insulin resistance, where your body's not responding to the insulin to sort of store those energy molecules into the right places, leads to huge peaks and troughs in terms of your glucose levels. And that can be very tiresome. That can make you feel very fatigued, feel like you're lacking in energy. And that sort of links to cravings as well, because when you're not responding to that hormone, that insulin hormone, in the way you should do, you have a huge spike in your glucose levels, and then it drops. And then when it drops, you feel hungry and you want to crave more sugar, and you want more sort of, easy snacks like chocolates, biscuits, crisps, things like that. You want to reach out for just to give you that peak again in your blood glucose levels. So the fatigue and cravings sort of go hand in hand, but also having high blood glucose, having insulin resistance affects all your other hormones as well, in terms of, how much you want to eat, your appetite and things like that as well. We spoke about immune system, about not recovering from illnesses, and just feeling a bit under the weather for a prolonged period of time. And there's multiple reasons why that might happen. So that underlying inflammatory process that we spoke about before, where you've constantly got your body running on a high rev without actually having the physical need to do that, that can run down your immune system. It can impact how much you're producing your white blood cells, which are the cells that help fight infections. But also, having a baseline raised blood glucose level is a fuel for bacteria or viruses. So you're basically feeding infections more so, and therefore you may be more prone to getting acute illnesses as well. And you may feel like you're constantly coming down with coughs, colds, but also more serious infections as well. Then, we've got the stubborn weight. Well, that again is linked to that underlying process of where your fat is being stored on your organs, not only within your skin. And that becomes very difficult to shift once you're down that inflammatory process. And again, the impact on the hormones that help and allow you to regulate your hormones, that allow you to sort of lose weight and regulate your weight in a proper way. And then the mood, we can't underestimate the impact of metabolic syndrome on your mental health. Low mood, anxiety, feeling depressed. These are really common conditions that we see. And there's a lot of evidence and a lot of research that links together the impact or the fluctuations in your blood glucose levels, and the impact that has into how you're feeling mentally, and how you're sort of managing the day-to-day stresses. But also, it's a two-way street. Stress is a huge factor in causing these inflammatory processes and raising the blood glucose levels and causing this spike. So, it's a two-way street there between mood, stress, anxiety, and metabolic syndrome as well. And it's really important to untangle that relationship and find out what the process is. And sexual dysfunction is a common thing that we see. So things like loss of libido, erectile dysfunction, and that's because of the damage of the blood vessels that happen, and that impairs someone's ability to maintain an erection, and perform sexually as well. And actually, this is what a really, really common risk factor. So sometimes in my clinic, I'll see people come in with erectile dysfunction, and my first step will be, we need to check them for diabetes, we need to check them for cholesterol, we need to check their liver enzymes, because this is a huge risk factor for ongoing cardiovascular disease. But what's really important to remember is not having any symptoms doesn't mean that you don't have metabolic syndrome, because it's high blood pressure, high cholesterol, fatty liver. These are all silent diseases. They don't typically present with symptoms at all, and they may be going at an underlying level for a long period of time. And a lot of the time, people will present with one of those serious health problems. So they may present at hospital with a heart attack, with a stroke, or they may present at the GP surgery with symptoms of diabetes. So we shouldn't be complacent about metabolic syndrome, even if you don't have symptoms. And it's important to remember that you don't have to be overweight. You don't have to have all of those factors to have metabolic syndrome. More and more we're seeing people who are of slim build, who are generally okay, generally living a healthy lifestyle, not drinking very much, not smoking, but they still have metabolic syndrome. And we'll talk about the risk factors related to metabolic syndrome a little bit later.
Yeah, absolutely. I agree. That's really nicely highlighted. And these sometimes we see things around the fact that we've got things that are hiding the metabolic syndrome. So when we think about things like thyroid dysfunction and menopause, and then obviously being diagnosed with the likes of depression, that can actually hide the fact that the metabolic dysfunction is happening at the same time. So I know that when women are going through menopause, if we're not metabolically flexible, if we're not in a good metabolic state, menopause is so much more challenging for us. But once we're in the thick of it, it's really hard to disconnect the fact that it's not menopause that we blame. And I think when you and I, Kish, did our first webinar together, we were looking at the stats around the fact that I think it's about 40% of people with depression were found to have insulin resistance. But because the focus was on depression, the insulin resistance had been lost. Yet the mind is metabolic. So if we haven't got great metabolic health in the body, the mind's going to be quite heavily impacted, and we cannot disconnect those two. So we've got to make sure it's not hiding behind a different diagnosis.
That's super helpful, both of you. Thank you. I mean, now that we've talked a little bit about that, I think we've covered some of these things, but do you want to talk a little bit more about sort of risk factors and, what could lead to metabolic syndrome?
Absolutely, yeah. So when we look at risk factors, what we're seeing, first of all, before we go into the risk factors specifically, we're seeing that metabolic syndrome is rising. And we need to figure out why it's rising, and that can relate to the risk factors. So 1 in 4 UK adults have metabolic syndrome, which is a huge stat there. We're seeing 30% of the population in developed countries have metabolic syndrome, and worldwide, it's about 14% of the population that's affected. So these are huge numbers that we're talking about, and this is something that's been happening over the last few decades. So we need to think about why it's rising. Now, we can break the risk factors down into modifiable and non-modifiable risk factors. So things that you can't change. You can't change getting old, sadly. You can't change your family history or genetics. You can't change your ethnicity. These are 3 big, huge factors that will raise your risk of getting metabolic syndrome. And there's not much you can do about that. There's not much you can control about that. But there are things that you can control: your lifestyle and your occupation. And the reason why occupation is so important is because most of us spend most of our time at work than we do at home, if we cut out the sleeping aspect of things. So, the role of your workplace, is huge. So, for example, when we're at work, you may be sedentary, you may be sitting at a desk, you're not getting enough activity, you're not burning enough calories, you're not burning enough fuel. And so that excess fuel can lead to the underlying risk factors of, raising your blood glucose, causing that inflammation, causing you to be in that sympathetic overdrive. Sometimes in some workplaces, depending on if you work in a train station or an airport, or if you're on the road all the time, you have poor choices of what you can have to eat and drink for lunch, for example. You have no option but to go for the fast food places or get the meal deal. Stress, we can't underestimate the impact of stress. Everyone's hugely stressed in their job. I very rarely speak to anyone that say, I'm not stressed, and we've got stress at home, we've got stress at work, and that stress causes a hormone called cortisol to be raised in the body. And that hormone is there to sort of implement that fight and flight response. And what it does is it raises your blood sugar, it mobilizes more energy, it raises your blood pressure, and all those processes are the key indicators of metabolic syndrome. So they all link in, directly into the sort of the diagnostic criteria for metabolic syndrome. And lifestyle wise, I think I'll let Natalie cover that, because that's very much her expertise. So I'll hand over to you, Natalie.
Yeah, we will. I'm going to cover lifestyle in a slide or two's time, but actually I want to touch on this fact that you mentioned earlier, Kish, and the fact that it used to be something that you'd consider over 60s. That's where we'd start screening and we'd be concerned, or we'd be watching for. Then it became an over 40s thing, although in some areas still over 50s. Actually, the biggest and heaviest knowledge gain that I've had, having this been my area of specialism, is in the last 6 months starting to understand how many children are impacted. So there are lots of things that we can't control. As Kish said, we can't change our family genetics, we can't necessarily change our ethnicity, and though those risk factors remain, but we've got a lot of modifiable risk factors like diet and lifestyle, which we're going to dive into. And the reason this becomes so much more important for us as adults, for people in the workplace, to not only help their health, but for the sake of their children as well, because we know children are like sponges. We know children tend to mirror a lot of what we do as adults. And in 2023, the stats for under 19s to have type 2 diabetes were over 1,560. So we are climbing very quickly towards 2,000 under 19s being diagnosed with type 2 diabetes. 50% of those also have high blood pressure, and another percentage of those have non-alcoholic fatty liver disease. And back in the year 2000, the number of children under 19 who had these conditions was approximately 0. So fundamentally, the landscape is changing. Kish and I's heart breaks over this all the time, and I'm sure Liz is with us here, and maybe a lot of you listening. This is changing, and we need to, as adults and as business owners and workplaces, really think about how we can not only have an impact on those working within us, but also their families as well.
No, absolutely. Definitely. Yeah. I mean, the stats are shocking, and it is definitely something that is a modern disease in a lot of ways, and something that we're really seeing, the changes in our lifestyle take their toll, certainly. I guess I'll talk very briefly about a little bit of the impact in the workplace, and then, certainly would love to hear if anyone else has, on the call today has anything that they want to share about impact on their workplace as well. But since metabolic health fundamentally impacts the functioning of our body, it can't be disconnected from performance at work, right? So we know that poor health costs the UK economy a huge amount, so 138 billion per year, due to absence and impact on productivity at work. We talk that's both a problem for the employer and the business, and also a problem for the employee who's actually trying to do their job well and wants to be employed, impactful and successful at their job. Employees lose nearly a day per week as a result of mental and physical health issues. So that's not just metabolic syndrome, obviously, but metabolic syndrome, I hope now everyone has come to understand from, what Kish and Natalie have shared so much, is has such a cascading impact on everything else that you can see its impact not just on the increase in these major chronic conditions that it links to, but also on daily performance fatigue, the chance that you're going to get the common cough and cold, the number of days you're going to need off because of that common cough and cold, and then also the number of days linked to mental illness. So, mental health is a massive topic, and, one for which there's been a lot, I guess, more done in the last, couple, maybe decade or so, but there's a lot more to do. But, 12% of absence days are linked to mental health. But as we already talked about, metabolic health issues increase your risk of mental health disorders. And so metabolic health is so important because it cannot be disconnected from these other things. And all of these are increasing problems in the workplace today, right? We're seeing more and more in the news. We're seeing more stats. And I'm sure that you all feel this in your workplace today, is that this is now affecting everyone, the working age population, and it's increasing. So it's something we really need to get a handle on. So maybe I'll pass over to Natalie and talk a little bit about sort of what can employees actually do? What are the ways to reduce your risk?
Let's flip the tone. We've done all the worrying stats and the reality is a little bit dark and a bit grim, but doesn't mean to say things aren't in your control and in people's power to make a change. I know sometimes it can feel like you're doing everything you can, but what I want to chat through here is maybe some additional things you haven't potentially considered, just on a couple of highlights so that it's not too overwhelming. But if we think about the fact that we have got a lot of modifiable risk factors in regards to our diet and lifestyle, I'm sure it's not a surprise to any of you that I'm going to recommend that you focus on eating whole foods. If you've read some of the books out recently, there are many available. And if you've started to read the packets in the supermarket shelves, I'm sure you've started to see some of the hidden ingredients and the volumes of sugar that are in certain foods that are ready-made and packaged goods. And that really starts to play into this impact of metabolic health. So choosing whole foods. And if you're wondering what a whole food is, think about what grows in the ground, swims in the sea, walks on the land, or comes from an animal that does that, aka an egg. That's your whole foods. And it really starts to, if you consider the supermarket that you maybe shop in, if you start to then navigate just those aisles, your supermarket shop will be much quicker because you won't be navigating so many of the aisles, because the majority of the supermarket is packaged goods these days. So think about focus on whole foods. Think about going back to as much as you can, what can be made from scratch at home, what can you batch cook, prep in advance, pop in the freezer, and get things done ahead of time. The initial starting point of that is often the hardest because you've got to navigate a few hours to maybe get that done. But once you've got a load of things going on in the freezer, suddenly you'll be in a flow and it'll actually be quite quick and simple. But just one step at a time, maybe just one meal at a time. And when you're thinking about how to make up that mix of meals, really think about having adequate protein. Protein really doesn't tend to disrupt blood sugars in the way that other nutrients can. Adequate protein to support your satiety, to help you with all the functioning that we need, because protein breaks down to amino acids, which is used for practically every process in the body, from the creation to DNA over to our chemical messengers in our brain and our immune system. Think about having good amounts of fiber. We do need to aim for about 30 grams of fiber a day, yet UK average has only nudged up by about 1 in the last decade. We're still on about 18 grams. So think about how much fiber you're getting in, and you're going to find that a lot when you go to the vegetable aisle. And think about healthy fats, nuts, seeds, avocado, extra virgin olive oil, good quality organic dairy can even be a beneficial one, eggs, one of my favorite foods. And having those 3 meals a day, thinking about what you can prepare in advance, what you can take with you when you go out, trying to limit snacks will really help your body to become a bit more metabolically flexible. The constant grazing throughout the day can be really disruptive from a metabolic perspective. So we want to be able to go from breakfast to lunch to dinner. If that suddenly feels like something you're panicking about, don't worry. All my clients tend to panic about that idea. We need to start thinking about breakfast first, really get breakfast nailed. If you can get yourself a good 30 grams of protein in your breakfast, then you're really going to be off to a good start, and it will have a big impact on the way that your body metabolically functions for the rest of the day. So even if that's where your starting point is, you're off to a winner. Staying hydrated, you've probably seen me sipping water throughout this, and I tend to carry a very large 2.2 litre bottle of water around with me wherever I go. But really do stay hydrated, particularly as we actually are getting some warm weather here. And trying to limit things like caffeine to 1 to 2 cups a day. They can be very stimulating. They don't give us energy. They actually give us a stimulation and a bit of a cortisol hit, which can feel like energy, but it's a bit of a fake give there. And it can have a big impact, maybe if you're already quite stressed, it can add to that load. It can also have a knock-on impact to our sleep. So we do want to think about whether caffeine is something you want to consider. If we are dehydrated, the concentration of sugar in our blood is higher. So even something as simple as getting hydrated and lowering caffeine, I've seen a big impact. I'm sure Kish is in the same here, that caffeine intake reducing can dramatically reduce blood pressure, and getting hydrated can also dramatically reduce blood sugar levels. Keep your alcohol in check. Again, not a shocker and a surprise here. Trying to keep about 5 days alcohol-free is a really nice routine to get into. I know that we've gone through a period of research where it was found that moderate drinkers had the best health. There's a lot of flaws in that research. There's a lot of flaws in regards to people don't drink because they're on medication for being unwell in the first place, and people who drink excessively obviously have certain issues there. There is no healthy level of alcohol. It doesn't mean to say you can't enjoy a glass or two, but appreciate the fact that actually there is no healthy level of alcohol. It is a toxin that the body has to get rid of. So if you keep about 5 days alcohol free, that's a really great change. And lastly, one that I am really keen for everyone to do is to slow down a little bit with their food. We've all forgotten to chew. We've all forgotten the fact that the teeth are the first part of the digestive system. So if you're complaining about being bloated, if you're complaining about the fact that your gut health doesn't feel in a good place, the first thing you've got to do is spend a bit more time with your meal, be very present, try not to be distracted in front of a screen or while you're working. If you're eating while you're watching this, you might find that you're slowing down now and putting your knife and fork down. Chewing 20 to 30 times for each bite, and obviously it's slightly different depending on what you're eating, but even a smoothie, if I'm having a smoothie, I will chew it, because the activation of the chewing really helps to kick off certain enzymes which help our digestive process. If we don't break food down in this upper digestive tract, in the mouth and the stomach, we have a much harder time further down. Hence, we end up with bloating. We don't absorb vitamins and minerals particularly well. And if we don't have good vitamins and minerals, we're going to struggle in regards to metabolic health and particularly in regards to weight management. So there's some top tips on nutrition. Shall I dive into lifestyle, or have you got anything you want to pick up there?
I think you've covered everything there, Natalie. I think that's really, really helpful actually to have those practical tips, very specific, down to the aisle. I think that's really helpful, and really makes people make the right sort of choices. And you touched on portion control before, and that's really important as well. Making sure that you've got the right size portions, you're not overeating. Everything needs to be in moderation, whether it's alcohol, whether it's what you're eating, and having those right choices are crucial.
Yeah, absolutely. And actually, it's really, you all go home now and measure your plates this evening. We often fill to the size of the plate or the bowl. Really, we need to start filling to the size that we are, or the size that our ideal body will be. And we can start using hand portions for that. And you can look those up. I think the NHS have a guide on those. You can look up hand portion guides for food to help you to start to make adjustments there too. So yeah, great reminder. And lifestyle, I'm just going to pull out a couple of these here because a couple are really obvious. Smoking and vaping. I mean, vaping was seen as a better form of smoking. We're actually seeing really big impacts from an insulin resistance perspective and a microbiome perspective. So as far as we're concerned, it's a no-go for both. Reducing stress. I know everyone says, how do I do that? It's really hard. We have to try and navigate the stresses we don't need and get rid of them where we can. Can we say no more often than we say yes? Can we remember our boundaries so that we support our health? And where can we take time to get resilient? So I'm off on a nature break next week and a detox. I'm heading to the Yorkshire Dales to do a lot of walking and a lot of reading, and my laptop will stay here. And that for me is a massive recharge. So when can you have these moments where actually you get to disconnect a little bit and make sure that you recover from the stress of daily life? Big couple of things to pick up on here is increasing muscle mass. We do store extra glucose in muscle. That's a really important function of the body. And we store about 80% in muscle, and the other 20% of excess will try to put itself in the liver. If there's more than the body needs and more than the body's expected, then we can have it converted into triglycerides, which store as fat. And as Kish said, we see those on blood markers. We can also end up overpacking the liver. So the liver goes from saying, I've got capacity for 20%, to us saying, well, you're going to need to hold on to a bit more of that. And we end up with non-alcoholic fatty liver disease. So gaining more muscle mass really helps you to support that metabolic process. It'll also help in regards to weight management because muscle burns a lot more at rest than anything else does. So it'll assist with longevity. I just can't stress it enough. And for women going through perimenopause, when we want to support bone density and things, gaining some muscle and getting in the gym is a really great thing to do. We also want to make sure we're moving our body throughout the day. So I'm sitting down currently, but I have a stand-up desk. The 1 hour in the gym for 8 hours at the desk still classes us as living a sedentary life. So we want to think about where we can bring in movement snacks, walking meetings, things like that. And then getting the 7 to 8 hours of sleep. I know I've gone from bottom to top and I don't know why on this one, but getting to 7 to 8 hours of sleep at night is vital. And a lot of people might say to me, oh, I do fine on 5 hours. You might think you do fine, your body will be struggling. And the reason they're often in my clinic is because of that very factor. And we do see that there is a massive impact on anything less than 6 hours of sleep. We see a huge health benefit on 7 to 9 hours. And we see that you get much better quality of sleep in the hours before midnight versus the hours after midnight. There can be as much as a 30% difference in things like blood sugar levels and the change in our hunger and satiety hormones just through a poor night's sleep. Irrespective of if you eat exactly the same each day, your metabolic health is going to respond differently purely because of that lack of sleep. So see what you can do. If you're currently a midnighter for bed, think about, can it be 11:30? You don't need to suddenly go to 10 o'clock. That's a real big ask. Can you just nudge it back little by little, 15, 20, 30 minutes at a time, and create a new routine for yourself? And we know that things like blue light can be really disruptive. So can you come off screens a little bit sooner to help the body actually get ready for sleep so that you can wake up in a better, healthier place the next day and keep moving your health forward?
Amazing. Thank you both very much. I might wrap up on this last slide and just talk a little bit about what employers can do. We're just about out of time, so we've run a little bit long. I don't see any questions yet in the chat, but if anyone has any, please pop them in. I also not sure if I can pull it up based on presenting as well. So Kish and Natalie, I don't know if you see any, but please do pop them in, and also, please do get in touch and ask us any questions after. We can follow up. We can, send back. We can reply on email to some questions for sure. Obviously, we're here talking about what employers can do and how you can, help improve people's health in your workplace. So, I think the first one is really screening and identification, right? Really help people understand if this is something that they have. And even if you only have one of the risk factors at this point, right, it's time to address that. And really, as Kish said, a lot of this can go symptomless. So can't stress it importantly enough. It can't stress enough how important it is to get early screening identification and start to help employees put in some of these lifestyle modifications. Certainly targeted exercise and health support. This will change depending on what you do in your business, right? So the way in which you can help someone get breaks in, find ways to help them get exercise and health support that fits with current role, capabilities, lifestyle. And that goes together with creating a supportive environment. So whether that's standing desks, walking meetings, breaks, whatever it is, there's ways that you as a business can help facilitate the small changes that allow someone to get more activity into in their daily life. Make meetings 55 minutes, enforce a 5-minute break in between. Think about what you're requiring from someone in terms of a shift pattern and how you'd be able to help people get a little bit of movement into a day. And then healthier food and drink choices. So, one of the clients we spoke to recently, implemented different lunch options in their canteen if you provide food on site, and really, had different meals that were tailored to different people's health concerns, which was wonderful to see. And then think about working hours and patterns. That's not easy to do, right? Obviously, these are long-term shifts, but they're things that certainly can make a difference. I realized we were just basically out of time. So, we'll stand for a couple minutes for any questions, but if anyone, needs to drop off, then certainly please do. Thank you so much for joining. And yeah, we'll take a couple questions, but we'll also share around the recording, and please pass it on and share with your colleagues. And yeah, we're definitely here to support and hopefully help everyone's metabolic health improve. All right, I will stop sharing screen, see if I can find questions. Great, we've got a comment rather than a question. Yeah, especially fatigue, definitely. I guess this is for Natalie. Are there any supplements that can help support recovery?
So my question would be to clarify recovery from what? I guess if we're thinking recovery from metabolic syndrome, yeah, there can be supplemental support, and that can definitely be put in. I always say under the guidance of a qualified registered nutritionist rather than going to Holland & Barrett on your own or the supermarket and purchasing. The supplement industry is blowing up, and it is growing in it's growing constantly. And what you've got is sometimes some very poor quality supplements that you can spend a lot of money on. So although there is, yes, I would definitely get specific advice for you. Some supplements are also not appropriate with certain medications and with certain health conditions. So these are all things that don't get talked about when you pop into a shop. So I really would get, get support to do that. I would also consider the fact that supplements are exactly as the name say, they are supplemental to the diet and the lifestyle that you have. And I have recently written an article on supplements that will be out soon. So please do come and find me. If you pop my name in Google, I will come up, or I'm sure Liz will share where you can find me. And I will be sharing that as part of my content as well. But do think about they are supplemental to the diet and lifestyle that you put in place first and foremost. And they're often used in acute phases to make sure we can improve where you're at, and then you can continue it with diet and lifestyle too. But get specific advice.
Amazing. Thank you. One more here. How else can I get started building muscle? So I guess outside of, other than weights in the gym, which can be a bit intimidating. So what else can help build muscle?
Yeah, I get this a lot, and I had a really interesting conversation with my group members recently around this. The gym member can be intimidating, and I come as somebody who has to work out in a military gym, because that's my option in my life. And I would always recommend that if it's something you want to do, maybe you consider the help of a PT, so that you've got somebody to walk with you through that gym. They're there to support you in navigating. And actually, a lot of the time, it's confidence rather than intimidation. We just aren't confident with which machine we're using, how we're using it, what weights we're loading up, where we're going to next. Is someone going to be on our machine? What's an alternative? And having a PT and a plan can really help you to navigate that. I also recommend doing things at home. If that feels like it's just in the future for you or not something right now, doing things in the home, either with online PTs, can be a great place to get confidence, or even using, if you're not in a position to bring weights into the home, using your own body weight, using things like resistance bands can be a really great way to start as you get the confidence to navigate the next phase of muscle building.
Amazing. Thank you. And I guess there's another comment here that probably raises a different question is, the NHS has some great programs, and, some fantastic programs certainly to support you once you've been diagnosed, with something. But, why, I guess maybe this is to Kish, sort of why isn't the NHS doing this, the early screening and testing? Why can't they do it? Ooh.
They over and that's still for sure.
Oh, I think we're losing you, Kish, a little bit.
But, they know limit of when you can you get it early.
Ooh. Yeah, Natalie, can you hear it properly?
No, I think we are losing him a little bit. There we go. That might be better. Try
Might be a
again.
little better. Try again. Oh, I think we've lost him. Unfortunately, he is frozen.
Okay,
Well,
I can't talk from an NHS perspective. I'll let Kish do that if he's able to come back. There is the conversations Kish and I have had around the NHS is the fact that certain.
Can you guys hear me?
Oh, maybe now.
Try again.
Again.
I'll pause.
No, I think we've still lost him. I think it's somehow the connection is bad or something going on with his laptop. He's in the room next to me, so presumably the connection isn't the problem with the laptop, perhaps.
I know a lot of the conversations that Kish and I have had is around the fact that actually the NHS are in a very reactive place at the moment. We know they're struggling. We know there's an awful lot of complexities around that scenario, which Kish is able to speak to much closer than I can. And they are very much in a place that they have medication and they have surgeries. They have things that they can do when a diagnosis is in place, but they aren't focused on preventative healthcare. That's not within their remit. It's absolutely not within their scope at the moment. They're far too stretched with simply being proactive. And if they don't have a medication or a script that they can give you, then there's no point in them necessarily spending the money in an area where they haven't got anything to offer. So they've got to be focused on where their current scope of practice is. And I will let Kish correct me on anything like this. Things like the diabetes remission programs are great. And we've had some clients come to us who have found them helpful but need additional support, and some clients who've not found them helpful at all. It's not going to suit everybody. No program's going to suit everybody, and that's just standard. But we've also, I guess, got to appreciate the fact that some people will come with quite complex conditions where actually, as I say, if you've got certain diagnoses that are masking other things underlying, then there's a lot more to go forward with than potentially just a group program that's run quite systematically. So I'll see if this is available to chat on.
I can't speak again from the medical side, but what I can say, what we see is that the the NHS just doesn't have the resources, and it's not focused on doing this early testing and prevention. And what we're seeing is with the scale of the problem increasing so much, it's so much more important to find issues before they become full-blown illnesses. And when in a time when you actually can put things into remission, where, or can reverse metabolic syndrome with lifestyle and with lifestyle and nutrition changes, and the earlier you find it, the easier that is. And so certainly, the people that we test, many of them have never had a preventative blood test, have never had any of these bloods done, have never had the chance to speak to a doctor just for 20 minutes to talk about their health, and it makes a huge difference, and they're able to implement lifestyle changes pretty quickly. And then we see that knock-on impact in the business and the productivity.
Yeah, I think like what you said in regards to the fact this can save businesses so much money. If we focus on prevention, we can save the NHS an awful lot of money in the long run as well, if we flip back to grassroots.
Wonderful. Well, why don't we wrap up there? We've run a few minutes over, but thank you so much. Actually, there's one final question we're going to answer, which is, what is the standard blood test you recommend to diagnose type 2 diabetes?
So for diagnosing type 2 diabetes, the gold standards test is something called an HbA1c. And that's the current recognized test to diagnose type 2 diabetes. If you want more preventative, we'd be looking at a full health screening like we've been discussing today.
Absolutely. And HbA1c is one of the tests that we offer. Of course, that's what we offer for diabetes and pre-diabetes, because it is the gold standard. Wonderful. All right. Thank you everyone so much for attending. We will share the recording to everyone who couldn't be here today. Please get in touch with any of us. We'll share the ways to reach us as well. If you have any follow-up questions, or if you'd like to have a broader chat about what we may be able to do for your business. So thank you very much. And thank you so much to Natalie and to Kish for being here today.
Thank you.
Thank you.